Congratulations on deciding to get the benefits you have earned and deserve. We will explain chronic fatigue syndrome on this video. Before we break down chronic fatigue syndrome, we need to talk about something that affects thousands of veterans: not seeking medical treatment. Most veterans don't get help for chronic fatigue because they think exhaustion is just normal. In the military, pushing through fatigue is part of the culture. We get used to operating sleep-deprived, overworked, and under constant stress. So when CFS symptoms begin, many veterans chalk it up to getting older, working too much, or not sleeping well enough. Others avoid seeking care because they don't want to feel like a burden, or don't realize the VA recognizes chronic fatigue syndrome as a legitimate rateable disability, especially for Gulf War veterans. If this sounds familiar, you're not alone. Many veterans only discover years later that their persistent, debilitating fatigue was actually a chronic condition tied to their service. Chronic fatigue syndrome is not normal tiredness. It's a medically recognized condition where your body simply cannot recover, even with rest. CFS often includes severe long-term fatigue, brain fog or cognitive impairment, unrefreshing sleep, muscle or joint pain, headaches, dizziness, post-exertional crashes, meaning even small physical or mental activity can wipe you out for days. For many veterans, CFS started after deployment, exposure to environmental hazards, or years of physical and mental strain during service. The key point is this: CFS reduces your ability to function in a way that is not proportional to your activity level. When we file a chronic fatigue syndrome claim, the VA looks for several specific things: a clear diagnosis based on VA or CDC criteria, and chronic symptoms lasting 6 months or more. They also look for functional limitations, how much your daily activities are reduced, and evidence ruling out other causes like thyroid issues, anemia, or sleep apnea. Consistency in medical records showing ongoing fatigue, cognitive issues, and post-exertional malaise is crucial. The VA doesn't expect your condition to be perfect or neatly documented from day one. They just need evidence that the fatigue is chronic, debilitating, and impacts your ability to function. Here's how the VA typically rates chronic fatigue syndrome: 10% for symptoms reducing daily activities less than 25%, and 20% for activities reduced by 25 to 50%, 40% for activities reduced by 50 to 75%, and 60% for nearly constant symptoms reducing activities by 75% or more, and 100% for debilitating symptoms that significantly interfere with almost all daily tasks. Your rating is based on how much CFS restricts your life, not whether you look sick, and not whether you're still trying to push through it. If you're not currently diagnosed with chronic fatigue syndrome, don't panic. This is extremely common. Here's what you should do next. Schedule an appointment with your primary care provider. Explain that your fatigue is chronic, severe, and not relieved by rest. Let them know when it started and how it impacts your life. Get basic medical testing done. Your doctor will often run blood tests to rule out thyroid problems, infections, anemia, vitamin deficiencies, autoimmune disorders, or sleep issues. Document your symptoms. Keep track of fatigue episodes, crashes after minimal activity, brain fog, and how these limit your ability to work or manage daily responsibilities. Follow up regularly. Consistent treatment records help show the VA that your condition is persistent, not temporary. Remember, getting diagnosed isn't about proving something is wrong with you. It's about documenting what you have already been fighting through every day. You've taken a huge step by learning about chronic fatigue syndrome and how the VA evaluates it. If you need help getting diagnosed, gathering evidence, or filing your claim, just give us a call. We're here to help you get every benefit you've earned.